In Texas, 1 in 4 nurse practitioners practice in rural areas. By exposing our students to rural clinics, they can have a better understanding of what it's like in those areas and be able to maybe one day return to those areas and provide primary care.
Rankin is a town of about 800 people located in rural West Texas. We rely on our nurse practitioners and our PAs.
Without the rural hospitals, when people are in accidents or have medical emergencies, they wouldn't have anyone to help stabilize them and help get them to the next level of care if that's what's needed.
Out here, you're kind of the only set of eyes, and along with your nursing staff that you depend heavily on. So we have to keep our mind open to all the possibilities of the condition that someone presents with.
If we don't have our local hospitals in rural Texas, where you're at least an hour away from a hospital, that's literally the meaning of life and death.
We don't have a doctor in this town, so we have to have providers that have a wide scope of practice, a wide range of knowledge and skills and expertise.
Being in a rural setting, like I may take care of a kid, but I also take care of that parent. I also take care of that grandparent. And sometimes you'll see them out in the community, and they stop and give you a hug. And I mean, that's just kind of the ultimate reward, is knowing that you've made a positive impact in a horrific situation that changed somebody's life.
The students that go to rural areas really enjoyed that. It was something they never knew they needed. It was also something that increased their awareness of what really goes on in that rural setting.
I'm very excited to be partnered with TCU in the nurse practitioner program. Rankin is a great place to come see a wide range of clinical experiences.
I think about my grandmother or grandfather. We grew up in a rural area, and I remember them suffering from things they didn't have to suffer from. And had they had a provider there close to them, maybe that would have changed their life expectancy. I think that my calling is to be in a rural sector because I see the need, I see the gap, and I see the camaraderie and the relationships that you can build with patients.
It gave me a new perspective on what patients have to go through to even get in to see their provider, and it helps me as a provider understand more about what I can do to help them.
Working in a rural clinic was so interesting because you'd show up and you'd have your day just like any other day as a nurse practitioner role. You'd get to see your patients, help them with their medications, whether that's for hypertension or diabetes, or see a sick visit. And then all of a sudden you have 5 ER visits and you have to completely change your course, your mindset, critically think, and just dive into those ER situations, get them the care that they need, and then go back to the primary care setting and continue to help your patients throughout the rest of the day.
There is a great need for primary care providers in the United States, and especially in Texas. TCU has welcomed that chance to meet that need. Here we're developing nurse practitioners to be able to go out into the community, into that rural healthcare setting, and provide primary care.